All right, we're live.
All right, good morning. It is March 10th, and this is the Senate Health and Welfare Committee meeting. We today are looking at what's known as the fast track bill, some of the federal dollars that are available to support during COVID. And so we're looking at the bill as it came over from the House, H315, and then looking at some of the issues that are concerned to us and how we might want to influence what's currently in the bill. So we're going to hear from a number of people. We will take a little break, and then hopefully we'll have some time for discussion and move on from there. We also have another bill on the agenda. We'll see if we get to that. Okay, so Stephanie Barrett is here. Are you here? Here she is.
Yes.
Good morning.
Good morning.
Thank you for being with us. We appreciate it. And do we have something from you on our webpage? Did you submit something to Nellie?
I did not. I assumed I was here mostly to listen. You have the bill. The bill is as proposed by the House.
Right.
There is a summary of the pieces of the bill from the House, but the Senate Appropriations Committee just yesterday started walking through the bill themselves. So they've had several questions that they raised about some of the pieces that are in the human service area. But I think that the best approach is to simply start walking through the healthcare and human service pieces as they're proposed by the House. What we do know is that these are proposals that came to the House Appropriations Committee from the House Healthcare Committee and from the House Human Service Committee.
Right.
But they were basically in letter form. I don't know if folks from the council are here as well yet, but they were the recommendations of those respective committees that were included by the House Appropriations Committee in the bill.
Okay. So what I'm hearing you say is, who is the ledge counsel on this that can walk us through the human services and healthcare sections?
So Jen Carby would be on the mental health and healthcare pieces, and Katie would be on the other pieces.
All right. Yeah. And we did get, I think we got a little spreadsheet for the expenditures within the bill. Do we have that? I think we had that earlier, and I don't know if it was the final form.
There is one that the House put together. I'm sorry.
Yeah, I know. That's the one we had. Nellie, can you dig that out, or Stephanie, can you send it along to Nellie and we'll put it up fresh on our webpage? I did look at it briefly,
Sure.
but I think it would be helpful to have it right front and center today.
Let me get it from the House committee. The other big conversation that happened in Senate Appropriations yesterday, and the federal bill that is very likely to pass at the end of this week, is the funding sources that are listed in the bill as it came out of the House are primarily general fund in this arena, but many of the items that are listed in the bill are items that can probably be switched to the new pot of federal dollars that is in the bill that we expect to be enacted by the end of the week at the federal level. There will be probably some timing issues around when those federal dollars are available, but the Senate Appropriations Committee is working on mechanisms to address that. And the idea there would be that you would not be appropriating general fund, you would be reserving that for other uses that aren't allowed under the federal dollars.
Right. Yeah, we get that. So I think as we go through and listen today and then look and see what is in the bill, we're going to have acute needs, and then we'll have some things that we may be able to put off to the next set of dollars that come to us. So this sort of confirms that. Great. Okay, so so we do have the bill in front of us, and I'm looking at it. There's certainly, we've looked at it previously. So what I think we'll do is based on your suggestion, and Nellie, when you get that up, can you let us know? Just put it in the chat that we have that. She'll let us know. Okay. So
Madam
why
Chair,
don't we, I'm sorry, go ahead, Senator
I was,
Hardy.
thank you. I was just wondering if there's, Stephanie, are you able to give us just an overview before we start getting all the testimony so that we sort of have a lay of the land?
Yeah, let me, I just need to open this document. I'm a little bit slow on my internet here for a moment. Sorry about that.
I love that picture in your house.
Oh. Thank you. Oh, where
It's
is
a
the-
window.
It's a window. Oh,
No,
No, it's a tile thing I bought 20 years ago in Portugal.
it's very cool. Anyway, sorry to distract you.
No, that's okay. I'm just trying to, I know Maria did a sheet on this and I'm just trying to find it quickly. They passed it out right before town meeting, that's why. Where is this? Well, I have another sheet. I'm gonna abandon VM for the moment and just gonna have to go directly from this sheet. So in the, let's just take in what to open to. So the pieces that I'm just going to run through them very relatively quickly, and they're all mostly either general fund or a combination of general fund and CRF fund as they came out of the House. In section 4 of the bill is emergency outreach and peer support for $300,000.
okay, so
Are folks, folks have the bill in front of them?
I was just going to say, Stephanie, we have the bill, but section 4 is on page 7. Section 4 says Department of Mental Health Housing Supports. So I don't know if you have the current.
The section, it must have gotten resectioned after she did this. So the housing supports, I had a section 5. That's the $4 million item.
Right, so the section 3 is the mental health emergency outreach service grants
Okay.
for 300,000.
So the Maria's sheet got renumbered, I guess, when the bill was finalized. So section 3 is the first section. It would be the emergency outreach and peer support piece for $300,000.
Okay,
And that is one. Most of these are all ones that we foresee switching over to another funding source on the Senate side, just because we have more information about the federal bill. The housing support $4 million item is the one that I think the Senate Appropriations Committee has the most questions on, and we haven't sort of run those to ground yet. Of whether or not that is setting up an ongoing obligation with one-time money.
okay. Yes, I think this is not this is not the rental housing support. This is straightforward housing support.
And my understanding is if it is going to go forward, there are proposals for redrafting the language around it.
Yep, I get it. I see transitional housing in here and everything else. Okay.
Yep. The next section would be the urgent case management services for $850,000.
Yep.
And then the mental health workforce training and wellness for $150,000. And the question that came up in Senate appropriations yesterday was mostly around whether or not you would, in terms of wellness support, is that sort of a new breaking new ground with something that we haven't really done before. And if we're doing that, why would it be limited to just one group of providers or one type of provider, as opposed to, a larger scale of providers in the community that might need wellness support.
Okay.
I think the next those came out of the House Healthcare Committee.
Mhm.
And then there's also further on in section 12, data collection at both Green Mountain Care and the Health Department on health disparities. I believe that's the other piece that came out of the Healthcare Committee.
All right. We also deal with anything that comes out of human services.
Yeah, and I'll go back to section, I think,
Yeah. Okay. Yeah, because I saw that there.
I think it's section 7 or 8. I'm a little mixed up on the section
Well,
numbers.
there is something in 7 that's a study.
Senator Lyons, could I just ask a question?
Yep.
At this point, going back to the wellness supports, Stephanie, you talked about like the housing being kind of a one-off, and appropriations is concerned about ongoing.
Well, this is all one-time money. So
This is
that's all
wellness
one-time
is
money. So the
one-time
question of
money.
whether or not we are setting up anything ongoing with one-time money is something
And-
you're keenly
and is
attuned to.
Would
Yeah.
that be a question applied to the wellness support as well? I mean,
It may.
Yeah, okay.
I think so, Senator Hooker, I think as we're looking at this, those are the kinds of questions that are going to come up, and we can make a decision as to what absolutely needs to be in fast track to get a kickstart and help people now. And then what are we thinking about for the next
Well, building the whole
federal
budget.
dollars? And then what about the base budget? What do we need total, going forward in terms of policy recommendations?
Thank you.
So go ahead, Stephanie. I think 7.
So the next group of them, section 8, 9, 10, 11, are the recommendations that came out of the House Human Service Committee. And $700,000 for New Americans, split between the two organizations, the Africans living in Vermont and the Refugee Resettlement Organization. Reach Up program grants. This is just it's a supplemental payment similar to what we did both with the vulnerable population money in the CRF bill we passed last spring, and a second payment. The conversation that happened yesterday in Senate appropriations around this particular item was whether or not a Reach Up supplemental payment, and this is also one that could move to the new federal funding source, given that assistance to households is an allowed use there, is whether or not we do something like what was done at the end of the fall into December through reallocated joint fiscal CRF dollars, which was a supplemental payment on the SNAP side. It gets to a larger population. That was the start of a conversation yesterday in Senate appropriations.
Yes, I know, and we did have that conversation in the fall about reaching more people. So, okay, that's helpful. Thank you.
And then there is the food bank piece related to the snafus around the food boxes. And the committee, Senate Appropriations Committee yesterday also is going to be adding an $82,000 item for the continuation of the diaper bank in this area.
A what?
That was an $82,000 appropriation for the diaper bank.
Yes,
they made that decision yesterday in the committee.
Okay.
In addition,
we had a communication from the Junior League providing information about the need for diapers. And so I don't know whether we've got that up on our webpage or not, but we'll put it there so that people can see it. And then we'll, as we hear from folks, we'll get filled in.
And then the
Okay,
last item is the $100,000 through Dale for the Association for the Blind. And this is also a continuation of funding that you provided back in the CRF bills to have technology to help with that social isolation issue there. So
yeah, okay. Was there any discussion about folks with disabilities who who are having difficulty or need some immediate technologies? No, okay. We might talk about that a little bit. All right. Okay. Is that the whole thing for us, or is there anything else?
that is the main, there's the other
Looks like
pieces
it.
that are in the bill are related to there. There is a VHCB piece, a housing piece. There's the economic development gap grants are in the bill. Working lands, they're forward funding some of the A&R pieces that are proposed by the governor. I think the Senate Appropriations Committee are talking about some other pieces that could be included. This whole conversation about the funding sources, the ongoing conversation. And then the other conversation is the extension of the HVAC work for schools is in this bill.
Yeah.
But also some additional recommendations from the Senate Education Committee are being discussed to be included in this bill.
Yes, yeah, I'm aware of those. I think Senator Hooker and Senator Terenzini are as well. Oh,
And I'm just going to check one of my other lists for just to see if any human service healthcare pieces are.
Stephanie, there's this data collection thing for the Green Mountain Care Board on health equity. Do you know more about that? It's section 12.
Yeah. So there's a piece to the Green Mountain Care Board and a piece to the health department. And the $66,000 to Green Mountain Care Board is is amount that was provided last year. The one question that the Senate Appropriations Committee had was just, is it timing? Is it needed in this fast track bill, or is it something that needs more discussion? And the other conversation they had is making sure that the work that's being done around health disparities, that Susanna Davis is brought in for consultation, to making sure that there's that alignment.
well, okay, thank you, Senator Hardy, for bringing that up. The question is, does it belong in the fast track bill at this time?
That was the one question they raised yesterday.
Well, that's a question I would raise as well, because I think we're going to see a list a mile long that could use those dollars more immediately. But we'll see.
There is money in the new federal bill for mortgage relief. There may be some conversation about it because this is housing related to, about sort of forward funding that in this bill and having it backfilled with the federal dollars.
Right.
I'm not sure.
I guess. Yeah. Sorry. Go ahead.
Yeah. That's that would that is it, I think, for the stuff that's in your bailiwick for this committee.
Right. So one of the areas looking for the VHCB piece was earlier. All right. Well, we'll deal with it when we get there. But where in this is the rental housing Where are the rental housing dollars?
So
are
there
they
is
still
not,
there?
so the December 27th federal bill had the
Yes,
$200 million for, that's a small state minimum for Vermont for the rental housing assistance. And it has a utility assistance arrearage piece in it as well. That grant was accepted by joint fiscal. And there is
Right.
the structure of that grant acceptance, how much for rental assistance, how much for utilities, how much is reserved. There's like 51 or $53 million of those, that $200 million reserved. That grant is going forward, you know, as an accepted grant. So it's not in this bill. The
Right.
new federal bill extended the date of that $200 million expenditure out by 9 months, which is good because it initially came with a December 21 use it or, you know, use it by then date, demonstrate that you can use 65% of it by September, et cetera. It also adds additional rental housing assistance of $152 million on top of that $200 million. That's the number we think, the Vermont number that's in there. And so the challenge there will be, can we expend those dollars? It comes with stricter sets of income guidelines than the programs we set up under CRF, because that was broader. But to hear, I think you would want to hear from Josh Hanford at ACCD on, he's the lead on that. There is still ongoing work to see if we can pay for any of the emergency housing out of that pot of money, the coverage of folks in motels.
Okay, and I'm going to ask a a question that probably the answer is no, but it seems to me that right now our long-term care facilities are in dire straits. I mean, they've lost a significant amount of money because they've lost their income from patients, but they still have to keep their capital expenses are still there. So I guess the question about that is, would any of the rental housing dollars be available to support these long-term care facilities in the interim?
That's a
Do you
really good
have any-
question. I don't have
Yeah.
an answer to that, but that's a really great question.
It is a question that's been burning in my head, and I would love to know the answer, and I don't know how. Can you help us dig down?
I will try. I'll bring that up to. Yes, I'll try and both the utility piece, but that piece of, you know, in certain long-term care, it is a rental arrangement. I'll find out if that's.
Yes, it is.
Yeah.
That's exactly why I asked the question, because
Yeah.
people are paying kind of the rent to be there.
Yeah.
Yeah. Okay.
The component of it.
That was going to
reminds
be
me, one other piece of discussion that was happening in the committee yesterday in the context of this fast track bill is in the workforce development area, and through the, you know, the program that's been discussed about having licensed nurses assistants through the state college system. Can we fast track that for the need for workforce in that arena? So.
okay. This is good. I think for me, I was going to bring up the long-term care question as we went through our discussion, but I think that this is a bigger question than I think any of our witnesses can probably answer, given what the federal guidelines might be. And I will ask for you to get back to us with an answer to that. We will.
I will find out what I can.
Yeah, that'd be awesome. Absolutely awesome. Yeah. Okay. The committee, any other questions for Stephanie? I see Nellie, sorry. Nellie's put the 2 documents up on our webpage that we've had previously, H315 highlights and the approved list of expenses from House Appropes. That's where we're beginning, I think. I don't think our Appropriations Committee, Stephanie, hasn't really made any changes at this point.
They've walked through, they've, accepted some
Yeah.
things in theory. They're, with the funding source changes, the expectation at the moment is trying to get the bill out early next week out of the committee. That's their,
Yes.
that was discussed yesterday.
So our goal in this committee is to inform ourselves today about some of the issues as we hear from folks, and then our own thoughts as we go through. And then we'll have some time, I think, before the end of the week to have a discussion about what recommendations we might make, either probably in writing as much as possible, to appropriations. In the meantime, we'll be juggling our discussion with Senator Kitchell. So business as usual.
Yep.
Oh, Stephanie, thank you. If you can
Sure.
hang around, it would be great.
I'm gonna stay and listen. Just because it's all contemporaneous here with the other committee's conversation.
All right, good, perfect. So let's make sure that now we have the information. Yep, we do. It's under Stephanie's name, so you may want to committee pull that up. We have seen some of this previously. All right. Okay. So now we're good. All right. I'm finding my agenda. All right. Thank you, everyone, for listening through that with us. And you're going to have to put up with the jets flying over. I can't turn them off. I will mute myself when others are speaking. But I understand that folks who are here to testify have already been through this a number of times. But we need to hear this information so we can make some decisions. There are some things that I think are not on our list, and we can have that discussion a little bit later. And one of those was what I brought up earlier regarding long-term care. So we have Erin Olican. How did I say that?
Pretty close, Olican.
All right. All right. Here, and you're from Reach Up, and we have that Reach Up section in the bill. So why don't you just share your testimony with us, and we'll get moving. Thank you.
Okay, thank you. My name is Erin Olican. I'm the director of the Reach Up program, and thank you for having me. I'm very pleased to be here this morning. It's good to see all of you. So Reach Up is a program that provides cash assistance and case management services to help people with work, training, and education, and to help alleviate barriers to work for families with minor children. So it's Vermont's Tanf program. We have about 3,200 families who are participating in the program, and that is about over 6,000 children throughout Vermont that this program serves. So these are families who are experiencing deep poverty. They're living below 42% of the federal poverty level in general. And a typical 3-person family would receive a grant of about $700 per month. So of these 3,200 families, 1,300 of them are what we call child-only households, and these families are receiving grants only for the children. So that about half of those families are kinship care. So it's adults other than the child's biological parents who are caring for the children, often grandparents or aunts or uncles. And then the other half of the child-only households are made up of families where the parents are receiving SSI, and so the parents aren't eligible for Reach Up, but the children are. So we have already been fortunate enough to have been able to send out some one-time payments to families on Reach Up. And so I wanted to kind of tell you a little bit about some of the impact of that. that's had for these families. So, a lot of things have been upended because of COVID, as you know. And so some of the things that families would have typically been able to access, like programs that provided coats and snow pants and boots for kids, were a lot more difficult to access during the pandemic. And so some of the things that families were able to use the funds for were things like buying all, winter gear for their kids so they could go outside to play, to be able to pay for their internet so that the kids could be connected for their remote schooling, and so that the adults could as well, so the adults could participate in education and training programs. They have used it, of course, for food, and food insecurity has been really high during this time. And so that's been another really important impact. I heard a lot of anecdotal stories about case managers talking to families about these payments, and families literally expressing so much gratitude and actually saying, please pass on my thanks to whoever is making this possible, because it's made such a huge difference for our family. So it's meant, in some cases that that families have been able to stay connected, and living in this type of deep poverty is especially isolating. And so for families to be able to stay connected with each other, with their case manager, with service providers, to be able to continue to look for housing, all of these things have been things that have been directly impacted by these payments so far. And just another thing is that research has shown that even a modest increase in income for families who are experiencing poverty, especially very deep poverty, has long-term outcomes for the children in those families. So we're talking about an increase as low as $1,000 in a year can translate to better outcomes for those children, especially young children, for years and years to come. So, these payments have enabled families to do things that they really need to do for their families, have increased, their well-being and their stability. And so we hope that we'll be able to do that again for these families.
Okay, thank you. So currently what's in the bill, are you advocating for what is currently in the bill?
Yes.
Yes. So can you speak to the concern that some have expressed that if we put these dollars into SNAP, it might reach more people?
Senator, I can jump
Okay.
in here.
Yeah,
For the
that
record,
probably is a good commissioner question.
good morning to the committee. I apologize. I was a little late when you started. I had a dentist appointment this morning that was long standing.
Oh, good.
I was a few minutes late to your committee, so I apologize.
But can I first just say thank you to Aaron and see if
Yes.
there are any questions from the committee on the reach up piece. Senator Hardy.
Thank you. And thanks, Aaron, for your testimony. And I guess it sounds like you are advocating for what's already in the bill. You're not asking for additional funding. And what's in the bill is part general fund, part CRF, I think. And that might be played with, I would assume, in the appropriations committee with all the federal funding, but you don't care the source. You just, I'm assuming you just want the funding, which is admirable. And of course, and I'm wondering, are you also advocating for longer term increases to the base funding as part of the big bill? Because that seems to be a perennial problem, and wondering if you have a proposal related to that.
I would defer to Commissioner Brown on that question, since this morning I was just planning to testify specifically on this legislation.
Okay.
Yeah.
That's fine. That's what we're here for. But it's always, we hear about it every year. And so I'm hoping we can take care of at least some of it this year. And thanks for your work with these families. It's so important.
Thank you.
Okay, thank you. Anything else, committee? We're good. Aaron, thank you so much. Terrific.
Thank you.
Yeah.
Take care.
I'm sure we'll be seeing you again.
Sounds good.
All right. All right. Commissioner Brown, welcome, and thank you for being here.
Good morning. Good morning. If I could jump in to answer Senator Hardy's question directed to Aaron that she deferred. There was not an increase for the base reach up benefit in the governor's proposed 22 budget. I would indicate that these payments for reach up families are one piece of the financial puzzle that we've been working on to support reach up families. Almost all of the families are also receiving 3 Squares Vermont benefits, and they've received a 15% bump increase under the federal stimulus packages that will run through next September. Also, given these are families with children, the school age kids initially benefited. These families benefited from the pandemic EBT benefit program to pay the value to families of free and reduced lunch when schools shut down last spring. That totaled about $15 million. One of the newer stimulus packages extends that benefit throughout this school year now. We're working on implementing that new program. It looks a little different than the initial program, given that we have to be aware of if the school district is fully remote, fully in person, or a hybrid model, and the payment we provide is based on where the school is at each month. And it is a benefit that also will be payable to children younger than school age, but that are also in daycare, and we'll be working to issue that new benefit out as well. And so that we're rolling that out in April. We are one of the first states to get our state plan for this approved. And so we're working right now to roll this out and working with the school districts to collect the data that we could provide. And then also there was a little earlier conversation regarding the $200 million rental assistance, small state minimum that the Vermont received from the federal government. And that was accepted through the joint fiscal process. As a part of that, $15 million of that $200 million was allocated to the Department for Children and Families for rental assistance. And we're working on a proposal right now to support our reach up families who have rent to pay a monthly rent benefit to all of the reach up families who have that expense as well. And so we're hoping to roll that program out in the near future. And with the extension of being able to expend those funds, we should be able to provide a significant boost to help families. We have about 2,200 reach up families that have a rental obligation right now, according to our caseload statistics. Out of the 3,200, 2,200 are renters, have a rental payment. Of that, about 1,100 of those receive a federal rental subsidy now. And so, so we would be able to help pay their portion that they're required every month on top of the federal subsidy. The other 1,100 are not receiving any type of federal subsidy. And so our hope is to come up with a formula to support those 1,100 that have a rental voucher already to cover the remainder, and then also be able to cover the rest of the rent for those 1,100 reach up renters as well. And so that's just some context. And then also Aaron's team, working with some of our external partners, did a really good job during the beginning of the pandemic, and she can speak to this a little bit as well. But many of our reach up families are such low income, they hadn't filed income taxes, and that was one of the requirements to receive some of the earlier stimulus payments. And so the reach up team worked with partners, and we sent out letters and provided just to make sure that families were aware of that need and to help them access resources to file taxes so that they could benefit from those direct stimulus payments from the federal government as well. And so a lot of work has been gone to support the Reach Up families since the start of the pandemic. So Senator Hardy, I hope that answers a little bit of your question, some of the work we're doing with Reach Up families.
So while you're there, yeah, Ruth, okay?
Yeah, I mean, it certainly I appreciate all the work you're doing sort of around the edges, and that's, and I don't mean that in a negative way. I mean, it's obviously the housing, the food support, the tax support, it's extremely important. I would like also to see an increase in the base for Reach Up. It's an annual conversation in this building, virtual building, wherever we are right now. And it would be nice to be able to make some progress in that area. So I'm hoping that we can still do that along with all the other things you just listed.
Yeah, thank you. Thank you.
So Senator, I think we're all passionate about improving the base, but I'm gonna ask that we focus today on H315 so we can get through everybody who's here. And I do appreciate your comments because the base has been unchanged for so long. Commissioner, the question I have is with respect to the subsidy, the funding, the housing funding and the rental obligations that you were talking about. Is the money that support is coming from in the $4 million for housing supports? Well, are you suggesting that that should continue? That's my question.
Oh, I'm sorry, Senator, I didn't hear your complete question. Could you repeat it, please?
Sure. I'm asking about the bill that we have in front of us. Section 5 has housing supports of $4 million. And my question is the support, are you suggesting that rental support and subsidies for these folks, the 2,200 folks with rental obligations, are you suggesting that that be continued at this time within that $4 million?
Yeah, so the 4 million, my understanding, the 4 million that's in H315 is dedicated to the Department of Mental Health for housing support. So the housing resources we've been accessing are from a different source. And so I would defer to the Department of Mental Health on that section of this bill.
So where is the money coming from for the Reach Up folks?
So that came to us when the state received the $200 million from the December stimulus.
Okay. Right.
Those funds were received through the joint fiscal process, and through that, the Joint Fiscal Committee allocated $15 million to the Department for Children and Families from that $200 million. And so we have those funds.
So then the question is there a need at this time to reinstate that, let's say, 15 million?
No, we have through the joint fiscal process, we have the authority to utilize those funds to support for rental assistance within the Department for Children and Families. So I don't think we need additional language here in the bill.
Okay, but for how long is that money available? I mean, how long will it last, I guess, is the question.
Yeah, that's what we're working on right now, Senator, and we're happy to report back when we're finalized with that analysis. We're working through those details right now to understand what the level of benefit we'll be able to pay out and for how long, and just to get an understanding based on what we understand of our caseload right now.
Well, I guess for me, the reason I asked the question is we heard from Stephanie Barrett that appropriations is thinking of taking some of the Reach Up dollars that are here and moving it to a broader population. So if the rental assistance runs out and then this is shifted over, I'm just wondering whether the Reach Up participants will be adequately supported.
Sure. No, that I'll understand. One of my concerns would be if they shifted the 1.3 million over, and if I'm understanding the question in the context, in December, we did receive another 1.3 million for Reach Up payments, but I think the committee's been referring to is that we also provided a supplemental $1.5 million food benefit to 3 Squares Vermont households who had not benefited from the max allotment provision in the federal stimulus bill that boosted everyone. So if households that were already at the max allotment didn't get a boost in their benefit initially. And so the legislature Joint Fiscal Committee did allocate resources so that we would be able to pay a supplemental food benefit one time. And I'm working from memory here, and we can get those details to the committee. I believe it was like a $279 payment to like probably 20,000 households, perhaps. It was a pretty significant number of households that received that benefit. And it was a one-time payment, and it did reach a broader group of older Vermonters and disabled Vermonters who might be on fixed income and already at the max allotment as well. And so 1.3 spread through that size of a population would probably cost more to issue the benefit out than what we would be issuing in a benefit, just for the committee's context at 1.3
Okay, thank you. And
yeah,
any information you can get to us on that would be very helpful.
And I do have some additional, another population that has come up are and it was in some of it was within the, that max allotment benefit that we issued out that one time, are the Vermonters who receive SSI and are participate in the Aged, Blind, and Disabled program, the AABD. And just to understand the caseload for the committee, if that's something you're going to be discussing, there are just under 15,000 Vermonters on SSI receiving an AABD payment in Vermont. 14,000 of those are either disabled or blind, and then another just approximately 900 are older Vermonters receiving that payment. And so that makes up the 15,000. Just to, if that was a population you were going to talk about, just to give you some numbers to understand who those folks are in Vermont.
Yeah, I know. And there is $100,000 included for them. And I do have a question about whether or not that's sufficient. I don't know. Do we know? Do we have that analysis? We'll have to sort that out.
Mm-hmm.
Okay. Thank you.
Mm-hmm.
Commissioner, what else do we need to know?
One, I'd like to thank.
But don't take it too far.
No. And I just wanted to thank Erin. She's done a fabulous job with the program through the pandemic and then in general. And she's being recognized on a national level and being asked to share some of her work here. And so she's done an incredible job. With us today, we also, another area we're asked to provide some information to the committee on today. We have Brenda Gooley, our Director of Operations from the Family Services Division, who is prepared to provide a little information to the committee regarding the impact of the pandemic on foster parents and some of the supports we've been able to provide to foster parents, and just kind of a snapshot of, foster parents have really been the unsung heroes of the pandemic, really have stepped up and been there to really support the number of kids that we have in foster care. And I just, they really are heroes, and just, I can't say enough about the work they've done. And so Brenda's available to provide some information to the committee as well.
Brenda, welcome. And Commissioner, first, thank you very much for your work during this time. And we look forward to working with you ongoing.
Same here. Thank you.
Yeah. Brenda, thank you for being here. Obviously, foster kids and foster parents have not been, are the unsung heroes. So can you introduce yourself for the record? I'm glad to have you here. I think it's the first time in our committee, so welcome.
Certainly, thank you. My name is Brenda Gooley. I'm the Director of Operations for the Family Services Division, and it's my privilege to speak to you about our foster parents here this morning. We have approximately 1,300 foster families in the state of Vermont today. We also have approximately 1,300 children and youth in DCF custody, the majority of which are placed in our foster homes. So approximately 850 of the children and youth are placed in foster home care. That includes kinship care. And our foster parents are volunteers. They are individuals that open their hearts and homes to children and youth that have been abused and neglected, children that often have significant trauma history. And even in what I would consider typical life experiences, being a foster parent is a very emotionally intense, very rewarding, but very demanding commitment. And the children and youth that are in foster care have intensive needs. They may have behaviors of challenge due to the trauma history. They may have special medical needs, special health needs. Often they are needing to be in childcare and educational settings. And all of this can be very intense during a normal situation. And it's even more intense when you add to that regular parent-child contact that is court-ordered, contact that is needing to occur multiple times per week, and needing to work with the courts, needing to work with treatment teams. This is the typical work of a foster parent in a normal day-to-day. Then you add the pandemic and all of the challenges that go along with the pandemic. And that has been a very intense additional layer of challenge for our foster parents, because many of them have experienced children that are unable to go to childcare because childcare settings have been closed for periods of time, unable to go into schools and receive education and go into services to receive those services. So those foster parents have been a part of providing the education and meeting the special needs of the children in their care in their homes without the training or support that would typically be associated with the kind of care that they're providing. In addition to that, when you think about parent-child contact, court-ordered parent-child contact, that is something that requires multiple households to come together. There's the household of the person supporting the contact, the foster parent's household, the caretaker's household, the parent, right? So we have many individuals that are involved all coming together. And we know during the pandemic that each and every one of those interactions increases the risk of COVID. So this is something that we have asked of our foster parents that has been above and beyond. And they have risen up in incredible ways, being there for the children, practicing additional safety precautions due to all of the COVID recommendations. We've had incredible success since the start of the pandemic. Only 3 foster homes have had COVID in the household due to the incredible diligence from the foster parents. And that's knowing that all of that parent-child contact is continuing. So we are so grateful to our foster families that have been able to stay the course through quarantine periods, through isolation periods, through all of the changes and challenges that the pandemic has represented, all of those additional mental health stressors across the board. They have risen up and been there for the most vulnerable children and youth in our state. So just an incredible group of people. We have done all that we can within the Family Services Division to support them. We were able in March, April, and May to take $625,000 of our adoption incentive funds and provide that to foster parents caring for children as an additional amount of funding in their stipend. And the stipend is, money that goes toward, food, clothing, shelter, basic care of the children in their homes. Additionally, in December, for all children that were in DCF custody at the end of December of 2020, we were able to do one additional payment of $300 per child using COVID relief funding. So we have been able to have some level of additional financial relief to our foster families. But I think I would say that what they are holding, what they are taking on, on behalf of these vulnerable children has just been absolutely incredible.
Brenda, thank you. I think that's very informative and extremely helpful. My question is about the $625,000 adoption fund. Is that a are those general fund dollars? Are they part
No.
of the regular budget?
No, they are federal
dollars.
They're federal dollars. The federal government looks at how many children were adopted each year and then requires states to provide a level of support to those children. For example, post-permanency case management support to the population of children and youth that are receiving those households that are receiving adoption subsidies. So it's money from the federal government intended to support the overall system.
I guess I should have asked it a different way. These are not federal COVID dollars. These are federal dollars
Correct.
that come to us as a result of having a foster care program.
That's correct.
So if there were, I'm thinking that the next money that we get from the federal government may well include additional funds to cover some of the costs that these families have incurred. It's an open question, I guess, because we don't know the guidelines, and Commissioner Brown are probably going to have to weigh in on this at some point as well. But it would be useful to know exactly what costs have been incurred and what needs exist as a result of COVID, direct results of COVID for these families. So I know there are some policy issues that I'm including in a little healthcare bill that we're putting together, but this is more about money. So.
Yeah, one thing I would point out for the committee is we're still analyzing the new stimulus bill that hopes to be signed by the president this week. But with the December stimulus money, we did receive an increase of what's called our Chafee funding, and Brenda can jump in here too. But
is that a percentage increase? Maybe Brenda can help.
We received an additional $1 million of funding, and that funding is targeted to youth who are aging out of the foster care and helping support their transition to independence and adulthood.
Okay.
And so we're working on a plan right now how to with our partners on how to spend those dollars to support that part of our caseload. They can be used from like a certain age up, like it's not limited to 8-year-olds, but it can be used even earlier ages as well.
Oh, okay. I was thinking of 18-year-olds and when they are no longer eligible for foster care. So this is different.
Mm-hmm.
All right.
Yes,
Brenda,
I mean,
do you want to add to that? And then I see Senator Hardy. Yep. Go ahead.
Okay, sure. Yes, we start serving transition age youth at 15 and go up through age 22. We do know that youth that age out of DCF custody across the nation are at significantly higher risk of incarceration, homelessness, and death. So very, very serious, very concerning outcomes for that population. So the Chafee funding targeting, ensuring appropriate supports and services, including housing, including lifelong connections work, is vital. And that's, I would say, the focus for those funds.
Thank you. Senator Hardy, you have a question.
Yeah, thank you, Brenda, for your testimony. I'm looking at the summary of the funding that's in H315, and I don't see anything that's specific to foster care unless it's embedded in something else. Are you asking for additional funding at this time, or is it being provided already? I'm unclear what the status. Do you have a request?
Sure,
for
we
us?
understood that it was maybe a focus of the committees. I wasn't sure. We recognized it wasn't in the bill, but I didn't know if this is just one of the areas this committee was looking at as expanding the scope of this bill, as this was one of the areas we're looking at.
Yeah,
So.
I think it could be one of the areas we're looking at. So that's my question. Do you have a specific request for funding at this point?
You know, we certainly would love to work with, you know, we're happy to work with the committee on that, and we can go, you know, we weren't prepared to come in here today with a number. We were prepared to provide information and kind of a background what we've done to date, but we're happy to kind of talk as an administration and work with the committee.
Okay,
So,
we don't have a lot
yeah.
of time, so.
Yeah.
Well, I deliberately asked for this information because I do want to know what the needs are. And what I'm hearing right now is that there may not be significant needs for this fast track bill, but there may definitely be needs going forward. And if I'm wrong about that, correct me, Commissioner.
Correct. I think, you know, our concern is longer term as we come out of the pandemic and how do we support our foster parents.
Yeah.
But as Brenda indicated, we've been working closely in monitoring the need and support for our foster families. So.
Okay. All right. And if you do have recommendations for us, either for this bill, which is a pretty fast turnaround, quick turnaround, or as we move forward, it would be very helpful to have that information.
Sure.
Terrific. Okay. And Brenda, thank you. It sounds like you have got your feet on the ground and doing some very good work, and we appreciate your time.
Thank you.
All right, good. All right, so we'll move on. Commissioner, I think that is it from your perspective.
Sure. Thank you. One other point I would, there was a question earlier in the conversation with Stephanie Barrett regarding whether some of the $200 million allocated in rental assistance could be used for emergency housing and motels. And that's an area we have been doing some analysis in as well. If the committee would like additional information, on our work and research into that area of the bill as that 200 million, we're happy to provide that to the committee. But I just wanted to indicate, based on that conversation, that is an area we've been focusing on internally right now as well.
Anything you have that would inform us would be welcome.
Sure. Well, we do not believe it could be used directly to pay for motel costs through the emergency housing program, where there may be an opportunity. Some motels do provide like a month-to-month tenancy to folks who pretty much just rent like an apartment, but a motel room or a suite in a motel on a month-by-month basis. And there may be an opportunity there, if that's the case, where there's a tenancy started, where it could actually be funded as like a rental payment, but not necessarily as like an emergency housing motel room. And so those are the details we're working through right now. But and I think depending on how it's administered would also be something we're looking at as well. If it runs through the emergency housing program, it probably might not be an allowable use even for rental assistance. But if it's run through another organization that normally helps with rental assistance, it most likely would be an allowable. And those are the things we're still finalizing on the finer details on. But that's kind of our initial analysis right now on those funds.
All right, thank you. All right, let's move on. We've got folks here representing the Department of Mental Health, and then we'll be talking with other care partners and so on. So Cheryl Wilcox is here and Frank Reed is here. Are you two? Do you have a plan for going forward?
We do have a plan.
All right, so we'll leave it to you. Thank you.
Okay. Thank you so much for having us. For the record, I'm Cheryl Wilcox. I'm our Interagency Planning Director, and also currently I'm overseeing our policy work. So Frank and I do have a plan to go through each of the sections briefly, and I will say an advantage to going after others is I'll start by answering the question of whether we're looking for additional funds. We are not. There are some nuances and pieces we would like to clarify, just as you all make your decisions, but we just had some additional information about the sections, and it's great to also know that Julie and Hillary are going to share more after us, because I think that will round out our picture. We appreciate that the funds in the bill allocate them to DMH. It's something we agree with and feel like we can distribute them accordingly. We also know that these funds are one time, and so there may be additional staff that need to be hired. And I know Julie can speak to that eloquently about the mental health system, but it is something we're keeping in mind. We also know that with these funds, we probably would not be able to expend them by the end of this fiscal year. And so we would be prepared to ask for the authority to carry over the funds so that all the funds can be used. Certainly the system greatly needs them right now. The other piece that seems important to let you all know is that we have a couple other grants, and Frank and I will speak a bit to how those intersect with these funds. We're paying close attention to which funding streams are paying for what. And we've been coordinating across our department and with other departments to make sure we're keeping our eyes on that. And we'll talk about how we feel like these are really a good way to coordinate with some other funds that will be ending for us. So those are high level. For the first section, I have that it's section 3. It sounds like we might have a couple different versions, but the emergency outreach to peer support and the LGBTQ organization, we feel really confident at DMH that those funds would be very appropriately expended. And we have had great collaboration with Pathways and with some other organizations with other grants we have. And so really appreciate funding being highlighted for organizations. And we feel really comfortable getting those funds out the door and having them be expended fairly quickly. So I think that's something that is a really positive piece. Regarding the next section for housing supports, I'm going to pass over to Frank, who has that level of detail and can walk through some of the pieces related to that.
Good morning, everyone. Frank Reed, the soon-to-be retiring Director of Mental Health Services for the Department of Mental Health. In terms of the housing resources, as Cheryl indicated, there's clearly a need for ongoing housing supports for individuals. Being able to access and get housing stability over the next several months would be very important. As one-time funds, actively connecting those individuals with the benefits that they might be eligible for and providing those peer and other professional support services to keep them successfully housed is going to be very important, and also monitored by the Department of Mental Health in the coming months if that comes to be. We recognize that supported housing is spread across AHS, so DMH and Dale work very closely with the designated agencies and SSAs, and also with the peer provider organizations. So DMH, if they receive the funds, would recommend that there be a broader intent so that we can use the funds most efficiently, to include very close consultation with the Agency of Human Services, Department of Aging and Independent Living, and also the representatives of the designated agencies, the SSAs, and the peer organizations who might receive those funds. The same would be a recommendation around complementary language in identifying participants and identifying the prioritization of the process for proposed projects, so that the intent is clearly collaboration and effective use of one-time funds. DMH in particular is very hopeful to leverage some of the funds for supporting peer organizations and assisting individuals in accessing and securing housing. That paired with the proposed case management supports for a time-limited period will help to secure the benefits individuals might need and some of the upfront startup costs for independent housing. And those are really the foundations for successful tenancy and housing permanency. We also recognize that there's going to be other people that are housed who may be experiencing hardship through extended mental health hospitalization. There are also those one-time opportunities that can be used to improve their situation, catching up on some of the resource issues that may come up in tenancy to keep them stably housed. And we can't ignore that there's also transition-aged youth and how those resources might be brought to bear for one-time use for that population is something that we would be also planning to think through.
Okay, thank you. I'm hearing the phrase one-time use frequently in this, and so that brings about the assumption, and I don't know that we ever make those, but all of these needs that you are presenting to us and the uses you're presenting to us are COVID related. That's a question. Are they all COVID related?
Currently, what we're experiencing now is certainly COVID related. And I'm also aware of that this is a one-time use of funds. So I'm repeatedly mentioning that to stay very clear. We would certainly utilize whatever funds can be put forward to help people in the communities.
Yeah, I mean, this is, we had a problem before COVID. And now it's been exacerbated. We know that. I do notice in the language in the bill that there's a suggestion that ongoing operational funds, something to that sense, ongoing funds would be required after some of these projects that are included in the bill. And that, I mean, we understand the need from a human service and healthcare perspective in this committee, no question. I think it is a question that appropriations will raise. So we need to be prepared to support COVID-related policies here in our committee. But can you, either one of you, speak to the issue? And maybe we should wait until we hear from Julie Tesler. I don't know if that's up to you, but speak to the one-time versus ongoing expenditure piece. I mean,
well, I certainly think that, I'm sorry to interrupt. I certainly think hearing from the designated agencies as well as the peer organizations on ongoing need is going to be, central in that consideration. So I would defer to them to help to paint that picture as well.
Okay, we'll do that. Senator Hooker.
Thank you, Senator. Mr. Reed, do the peer organizations include recovery centers? Is that?
Yes, in fact, Hillary Melton, I think, can speak specifically to some of the recovery center activities that Pathways has been involved with.
Thank you.
I think the other piece I would add is that one of our grants that we got, federal grants that has been providing crisis supports, which also we're hoping we'll get an extension on, but is one-time funds, has also gone to recovery centers. So I think one of the things we've been watching closely is we have a number of one-time funds that are going out during this crisis, and we know that the effects will be felt for much longer. So trying to see how we build sustainability so that at the end of the funds being done, we don't suddenly have a cliff that exists.
So in terms of the recovery center, I'm glad that Senator Hooker brought that up, and we will get to Hillary Melton in just a minute. But from your perspective, how are those dollars being spread out across the state? I mean, are they going to a Turning Point Center, or how are they being utilized? Where are they going?
Vermont.
Sorry.
Go ahead, Cheryl.
Go ahead.
Okay.
I was going to say, I know ADAP would have a lot more detail. I know through our emergency services grant, they're spreading it statewide for recovery centers and have been investing that. But I don't have more detail than that. I don't know, Frank, if there were additional pieces that you had.
No, the recovery centers that I was thinking of primarily are in the Chittenden County area, but there are also other organizations another way, the Vermont Psychiatric Survivors, that provide peer support services throughout the state, and they remain active.
Okay, thank you. All right, committee, other questions for Cheryl or Frank? All right, So you're supportive of the language that's in the bill in the section 3 and section 4 is what we're hearing.
Yeah, so we have additional information for section 5.
Okay.
If you go there next.
Yep.
So this, the opportunity for the case management services as outlined currently, I think the timing works very well with our Community Crisis Program grant, which is a grant that is supported by both FEMA and SAMHSA, which started immediately following the initiation of the pandemic executive order and has continued through June of this year. It is now beginning its phase down process. Currently, we have been in partnership with Vermont Care Partners in the creation of COVID Support Vermont, which houses 3 support counselors in the 211 call center so that they triage calls and then make area referrals and offer an array of wellness activities for individuals that have difficulties during the pandemic. The current language that would provide ongoing case management support for a number of months beyond that grant would actually be a great transition for that services to make those connections locally again, and having individual regionalized support people familiar and supportive around COVID support needs, whether it be the anxieties or impacts of COVID support, pandemic, or if it's support to the homeless and temporarily housed in motels, that would be a beneficial use for those funds that are going to be time limited as they transition back to local services.
Okay.
I think another piece that is similar to the last section is also hoping we could see language adding our partnership with the Secretary's office and with our Department of Disabilities, Aging and Independent Living. I think one of the things we know, and it's actually why my interagency role exists, is that we have many families and individuals and children that receive supports or services across our departments. And so it's important for us to make sure we're coordinating and not leaving any of our specialized service agencies out that are under Dale purview and provide developmental services. So also wanting to make sure that we recognize and pay attention to that.
Okay, that seems like an ongoing issue that we may circle back to at some point.
Yes.
Thank you.
Thanks.
All right, why don't you just keep going through all of your sections that would, and then we'll move on to Julie Tesler.
Okay, we just had one more, the section around
Yep.
mental health workforce training and wellness. So the $150,000, we definitely believe we have some expertise within both our mental health network and also some other partners that do training, that this would be really valuable. We also know there's another Senate bill around possibly creating a commission that may sit at the Department of Health for emergency service provider wellness. And so thinking about how we could coordinate with that and make sure it's all tied together. But we appreciate this being added and feel like it is a substantial need.
Good. So this again underscores the need for some ongoing support. All right, questions committee. I do have one question. I know that Senate Education is going to be working on issues related to kids and school mental health support services. How much have you been engaged in that? And I know it'll show up in the budget. I think it will be an education proposal, committee proposal to this, through this bill, but I wanted to know what involvement you've had with that or any discussion with that. And maybe it's Julie we turn to, but we'll ask you for now.
Might have. Our children's director, Laurel Umland, has been the connection with our department. She's been very involved in the mental health supports, and we know that what has been happening around children needing more mental health supports and that so many are getting them in schools. It's something we're closely watching, and I would say if the committee needs additional information, Laurel Umlin would definitely be able to speak to that very thoroughly and eloquently.
Okay, thank you.
You're welcome.
And we do know the urgency of that. We also know, we've heard that from some of our primary care providers, how key it is to have primary care linked in with our schools. And I don't know to what extent you are involved in any of that coordination. I know you're interagency coordinator or working with different departments, but have you been involved at all with primary care and schools?
Our children's unit of our team has. So there's another grant that we have at our department that also helps with that. And there are some funds in a couple regions that have integrated funding that have also invested in having closer collaboration between primary care providers and having mental health workers. So it is something we also are focused on and have grant funds and some other pieces that are being invested in that area.
Well, I think, that's great. And I think it's going to be important going forward. But I guess my question is in the context of COVID and right now for the significant increase in needs that we're seeing, particularly with children, so the pediatric need, if you have given thought, you collectively, your folks in your department have given thought to how to coordinate some of this during and frankly after the pandemic, because it's going to take tincture of time to cure this.
Agreed. We have, and I also, I don't want to put Julie Tessler on the spot, but she may have more information. I know children's directors have also spoken about this. And also, again, if it's something the committee wants to hear more about, we'd be happy to do that.
Okay. I think whether it's associated with this particular bill or going forward, we are going to want to hear more about it. But I think very specifically, specific recommendations and how linkages are being made and how it will be supported going forward.
Okay,
So,
I will follow up on that. I'm happy to.
Okay, thank you.
You're welcome.
Senator Hardy, question.
Yeah, thank you, Cheryl and Frank. Cheryl, I heard you say that you had some suggestions for language changes in one of the sections, and just wondering if you could send that along to us if it's something that you would like to see amended in this bill. And then second of all, just follow up on a question that Senator Hooker asked about recovery. And I don't want to speak for Senator Hooker, but I'm wondering, what I heard in your answer wasn't specific to substance use and abuse recovery. And I'm wondering if any of the funds that are going toward mental health are also going towards substance use recovery. And if not, if you have recommendations in that area, because this is an area that we've heard there's a tremendous need in, and it doesn't seem like these funds are directed at that specifically. So just wondered your thoughts on that.
Frank, if
I can speak to that.
Okay.
We are certainly sensitive to the co-occurring nature of presentation. So with mental health, there's also often substance use associated. We do work closely with ADAP to coordinate support services, and between ADAP's recovery supports and mental health recovery supports, there is a great deal of overlap of the population that's being served. And back to your question on additional resources for that effort. I'm sorry, Senator Hardy, I wasn't quite clear.
I'm just wondering, this seems like a big need right now. As you say, the sort of co-issue of mental health and substance use. And none of these funds, as I look at this sort of spreadsheet, are specific to substance use treatment or recovery or counseling or whatever. And I'm wondering if you have recommendations for additional targeted funding and where that would go. Or if this is out of your purview, then you can say that too.
Yeah, and I would look to the folks that have more boots on the ground for this. So I think Julie can speak in terms of what is seen in the community as well as the peer organizations as to what is seen and to make those recommendations as well.
Okay, thank you.
Yeah, good. So language recommendations, please do send those in to Nellie and we'll take a look at them.
Okay.
And Julie Tesler is here, and now we can get to, I think, ultimately to some of the co-occurring issues that are being asked about. But Julie, welcome. Frank and Cheryl, thank you so much, but don't go away.
Not going anywhere. Thank you.
All right, good. Julie, why don't you introduce yourself for the record and then go ahead and, I see you've given us quite an extensive, what I consider to be extensive, I know it's not everything, testimony, but we really want to focus today on the bill itself rather than on any of the future needs. And I know you've included some of the ongoing needs that are there, but maybe you could comment now on the bill. Thank you.
Thank you for the opportunity. And I'm actually going to put I'm not screen sharing, but I've got it on my screen so I can't see your faces. So tell me if I've erred in any way. I would be glad to just speak about the bill, but if on the first page of the document that I did send in, I do want to just highlight that we surveyed our agencies to say, what are the investments you need? And we very much appreciate the $4 million directed towards housing. We're also, we do need the investment in housing. We need to purchase new buildings. We need to renovate buildings. We've got a number of people we serve who are older or cannot access the buildings we have now because of different disabilities. So we need things like ramps and elevators. We've also been ignoring our facilities and focusing on funding services. So our facilities are in really difficult shape. So we also need renovations to the facilities to just keep them, like we need things like boilers and roofs replaced. So it's accessibility, it's safety in some cases, even surveillance systems and locks, but it's also about HVAC systems, air conditioners, air filtration systems. So if new monies or more money were to be available, we actually could use significantly more. So just for new facilities, we estimated, well, we didn't estimate, we added to 8.8 million. In renovations and upgrades, we need 7 million. And the repairs and maintenance of really basic things like the boilers and roofs, we need $1 million. So the $4 million, we're very pleased in section 4 for the $4 million. We actually would like the language to be broader so that we would say the grants could be used to make existing housing and community-based service facilities more accessible, safe, ADA compliant, and expand capacity. That way it wouldn't only be for housing, and that also addresses the one-time investment. If we renovate, the housing costs remain the same and the operational costs remain the same, but to expand housing, it's hard not to have increased operational costs. So we would be very pleased to have greater flexibility with the dollars and would definitely invest it in community facilities, but also in the services to make the services more accessible and safe. And we're fine with the monies going to the Department of Health. We appreciate their commitment to work with Dale and AHS because we go broadly between mental health and developmental disabilities. The House Healthcare Committee focused on mental health because that's their purview, but we hope it will be broader. And I just wanted to give very specific feedback on the funding for case management staff. We appreciate that. We had asked for it. Our estimate that it cost $85,000 per staff person. They don't earn that much. There's benefits, there's the supervision, there's a lot that supports each staff person. So $850,000 would work for 10 designated agencies. But if we include Pathways for Housing and NFI, then to have $85,000 per person would be $1.02 million to cover all 10 designated and the 2 specialized service agencies. So we'd ask for your consideration about that. We are flexible about the health and wellness programs. It would have been our recommendation because we look at our staff and see how stressed they are and what they've been through and are looking for ways to provide them with support for the trauma they've endured in working with the people we serve and to help them with their wellness. But we certainly understand a broader approach and we'd be glad to provide the training, work with Department of Mental Health. We have been doing a webinar series and I think that would be an effective approach to reach out to a broader community, but we're totally open about how to do that best and we appreciate the resource. So that's my very quick, very specific to those 3 sections that would involve designated agencies.
Thank you. And thank you for including your recommendations so that we can look at those in balance with what is already included in the bill. Questions committee. I think there were 2 questions that you heard earlier. One is a question that our committee has been concerned about for a bit now. That is on recovery, and we've heard from folks in the recovery world about the significant needs that they're facing. And to what extent do your organizations intersect with or have representation from recovery programs?
Well, all of our outpatients, all of our services are co-occurring informed and we work with all the community resources around us. So that includes recovery centers and healthcare providers, schools. So it's a collaborative approach in the work that we do. And one of the challenges we're having, and this goes beyond H315, is our ability to pay our master's level clinicians. We have a real shortage of those clinicians because it's hard for us to recruit and retain them because of our salary levels. So that's one of our big challenges in our co-occurring services, is to have the clinical staff on hand. In July, we had 479 staff vacancies at our agencies, and in February we had 780 vacancies. So we're not in an upward trend here. And we had actually the director of adult mental health services, HCRS, testified yesterday at House Healthcare, and she said it's really difficult for her to be assigning interns and folks that are just going through their education now to provide clinical supports for people with complex high needs, including those with co-occurring needs, right? It's hard for us to retain experienced staff because once they get their licenses, they go off and get higher salaries elsewhere. So that is very troubling to us right now.
It should be. We worked really hard, I know, last session with you to try to improve that outlook, and COVID has probably undone every good deed we've put in place.
Yeah, and I totally appreciate the support that we've received. And we also hope this committee will be looking at the RFI that ADAP has issued and think about how that fits into the healthcare system and the impact on service dollars. The idea of creating a separate management entity with no new funds. So we're actually going to be talking with ADAP leadership in the next hour about that and how is that going to work. So hope that legislators also will take a look at how that substance use disorder system of care is kind of being thought about for the future.
Yeah, thank you for that reminder. It is something that we have on our list of things to look at. So maybe we'll get to it sooner rather than later. Thank you.
Thank
Committee
you.
questions for Julie with respect to H315. Okay.
For the opportunity. And we'd be glad to have
I
someone
did-
come. I'm sorry.
Senator Cummings has a question, and then I'll have a question.
Yeah.
Go ahead.
We've struggled with the base funding for our designated mental health agencies. If we decided to raise some funding, how much would it take? And what are we talking about to raise salaries commensurate with the entry salaries at the state or the school system? You don't have to give me an answer now.
Right,
but that
right
would
off the
be,
cuff,
that would
right
be
now.
something
I can.
that would be just
Can you?
helpful to
All
know.
right.
Yeah. For each 1% of raising our rates, it's 1.75 million in general fund. And we would really need to raise salaries by 10%, I would say, at least, to have an impact. So that would be 10 times that number. But any step in the right direction is good, because what's happened is it's like each year we don't get an increase and we get
Right.
further behind, and then it becomes less doable. So 2%, would at least not make it any worse next year when state employees, school employees, healthcare employees get pay raises.
Right. I mean, we've talked. This obviously is not an H315, but we have talked previously, I know, and Senator Cummings in particular, about some kind of a cost of living increase linked to our DAs and our SSAs.
Well, I'm thinking about raising revenue, which is the only
Right.
way we're going to be able to do that.
It's the only, absolutely, Senator, you're right.
Yeah, I mean, that's the bottom line.
Yeah.
Thank you.
Okay.
Any other questions about H315? Our committee is great about going off in different directions, but they're important directions. One last question, Julie, and then Senator Hardy will have another question. But I did want to bring back the question regarding wellness, mental health supports for our kids, and any work that you're doing in association with our primary care folks now in terms of COVID. The proposal that's going from education will probably not include the healthcare world, but I see that as a strong linkage going forward. And I'm wondering if you've had doing any work with pediatrics or primary care and school embedded support services.
That again is like our ongoing work. We are in 90% of supervisory unions, which is a smaller number of schools. And we are in pediatricians' offices, not all. It's voluntary. We have collaborative relationships, and it's really important. And I would be very happy to have one of our children's directors come and speak to the committee about the work we're doing and where the challenges are. But certainly the remote learning is adding stress, families kind of being on top of each other, financial struggles, food insecurity. There's just numerous stresses. And I don't know if you've been noticing, on Fridays, we have articles in the Vermont Digger, and we've done a few of them about children in particular, because
Right.
we're very concerned, and parents and others need support about what can we do to support our children during this very difficult time.
Thank you. Senator Hardy.
Yeah, thank you, Senator Lyons. Thank you, Julie, for your testimony. I'm looking, your thank you for providing the written testimony with your specific recommendations about H315. I'm particularly focusing right now on the facilities stuff, because we're talking about one-time funding. It seems like one-time funding is perfect for upgrading facilities. And there are just so many interconnected things in that request. I mean, just as an example, I would shout out to my seatmate about weatherization. You have in there insulation and replacing windows and all that stuff. So that meets the goal of, energy efficiency and the ADA compliance. It seems like that in and of itself, if there's a way we can get you more than the $4 million for one-time funding for facilities, that would be an excellent use of this money. And if we're looking now at dipping into the other federal funding that is coming our way, I guess I just wanted to say for my committee's benefit also that's where I would like to focus, given that facilities is the perfect thing for one-time funding, and that would have long-term impact. And I'm sure you can speak eloquently about the, good facilities lead to better mental health. So it seems like a no-brainer to me, if we can find more money for that line item. And just wondered if you want to say anything else, or if I just wanted to put that out there.
I am thrilled to hear that. Thank you so much. And actually, I can share the actual spreadsheet that can show you where each agency would invest those resources. Very specific.
That would be great. I love spreadsheets.
All right.
So good. And listen, this isn't the last of the federal dollars that we're going to be seeing. So don't hold your breath. But I think we've heard this many times, and this is really, we understand how critical it is. Senator Hooker.
Thank you.
Yeah, I would just like to follow up on Senator Hardy's comments about housing, because I see a real connection here with economic development's VHIP and how we could, really expand that, and certainly a partnership with Pathways as well, and the way that they would work. I know last year we tried to establish an office for Pathways down in Rutland and Bennington, and COVID got in the way. So maybe this is a place that we can at least start that process again. Thanks.
Good. I said we do have Pathways on our agenda next, so maybe we'll hear some more about that. Any other questions for Julie? All right. What I'm going to suggest, committee, is that we finish up our testimony on H315 and then take a little break, and then we'll come back for some discussion. So, and we'll have a hard stop at 11 o'clock before we take our break. Thank you very much, Julie. As usual, you've been extremely helpful.
Thank you. I appreciate this committee's support.
All right. All right. So we have Hillary Melton and Rebecca Lawrence both here representing Pathways. Do you want you to go ahead and introduce yourselves for the record, and then share your testimony as I'm assuming you have a plan for that. Maybe I shouldn't do that. Go right ahead.
No, it's okay to assume.
All right.
My name is Hillary Melton. For the record, I'm the executive director at Pathways Vermont, and Rebecca Lawrence is with me. She's the assistant director. Thank you for having us, and thank you for all of your hard work about this COVID-related story. Pathways, for people that don't know us, Pathways Vermont's mission is to end homelessness in Vermont and provide alternative mental health services. We're an expert in housing first. That's what our specialized service agency is for, Housing First Services. And we also run the Soteria House, the Vermont support line. We have a community center in Chittenden County, and we work with the University of Vermont to end veteran homelessness. And we're part of the AHS rapid rehousing program related to the motel story that's happening right now. I'm going to use my time to read from a letter of a supporter that sent in a letter of support to Senator Sears he's from Arlington. His name is John Rogers. He was a pastor there, and it's not very long, but he says, given the positive impact I have seen firsthand, I'm writing to respectfully ask for your support for the proposed funding for the Department of Mental Health housing support in H315. I have firsthand experience with Pathways Vermont. One of my regular attendees was a chronically homeless older man that had been living unsheltered on the streets of Bennington for the bulk of the past 20 years. He and I became friends in early 2019, and as I got to know him, it became obvious he suffered from mental illness. It did not take long before I had the bright idea that I should advocate on his behalf and simply solve the problem. After all, I'm a capable enough man. A few phone calls and a meeting or two, but again, a bada bing, bada boom, problem solved, right? Well, it was not so simple. And after 2 years of phone calls, meetings, and paperwork, I was on the brink of giving up. It was at this time that I got a phone call from Chandler Pooling, who had changed jobs from Brock to Pathways just a few weeks earlier. He told me about Pathways' evidence-based housing first model and said he was confident that he could help my buddy get off the streets quickly and help him with other critical support needs. He was right. Within 4 weeks, we had secured funding, found an apartment with a landlord willing to rent to him, and signed a 1-year lease. This all went down in January, and this year, just weeks before the temps went into the deep freeze. We now are in March. Mike is living independently in his new apartment, paying rent, back on prescribed medication, and doesn't call me in a tailspin all the time. He has others who care for him in his life. Pathways Vermont operates a program called Housing First, which provides critical support services to Vermonters facing homelessness and experiencing mental health challenges. The House Healthcare and Appropriations Committee expressed the intent that some of the $4 million appropriated to DMH should be used for Housing First programs. Most sincerely, John. And then I'm going to pass off to Rebecca. And just before I say that, I think in this COVID pandemic, housing is critical, and for particularly older, vulnerable Vermonters that are experiencing homelessness, and that's truly our expertise. And I think we're being, I'm feeling in a cage. I feel underutilized. I know we can do more if resourced. So I appreciate all of your work that you're doing. I'm going to pass it off to Rebecca.
Thanks, Hillary. Thank you, Senator Lyons, and all of you for inviting us here today. For the record, my name is Rebecca Lawrence Gomez. I use she, her pronouns, and I am the Assistant Director at Pathways Vermont. I have a presentation, but I know we're a little tight on time, and we provided it to Nellie so folks can see it through other means. But again, as Hillary articulated, we're here to...
Rebecca, I'm going to ask you if there's a way you can speak more closely into the microphone.
Sure. Is that a little better?
Yeah, it is. Thanks.
Okay. Thank you. We're here to advocate for and support the request for housing funding and for the supports connected with it. Specifically, Pathways have requested $2.5 million to end chronic homelessness for Vermonters. So this would take the evidence-based practice of housing first that has been proven effective in multiple communities and expand the availability so we could have it statewide. We're currently in a limited number of counties, and this funding would not only allow us to expand that to all the counties and address the individuals who are currently residing in the hotels and motels and temporary settings who struggle with mental health issues, who struggle with substance use and mental health. It would also allow us to expand our current services to, again, encompass and support those households who are in similar circumstances of experiencing homelessness and struggling with mental health.
All right, thank you. Do you think that the money that is currently in the bill, would it go expressly to meet the needs that you're talking about through pathways?
I am not sure, and Hillary, maybe you have a response to
I think
that.
well, the language is a little, it doesn't say pathways in the language. So
Right, well, it can't say pathways, but it does, it would imply replacement of motel living and provide for more permanent housing. And it is a response to the increased need that we've seen during COVID.
Absolutely.
Good. All right. Thank you for your work, and I know it's always a pleasure to have you in and talk about the good work that you're doing. Currently, I believe that the helpline, the Pathways line, is operating 24/7. That's fully funded. Will we be seeing a request for that going forward?
I think they're talking about putting a request in the base budget.
Okay.
Forward.
Yep.
Yeah.
Okay.
So
committee questions for Pathways. All right. We're good. Senator Hardy.
Sorry, I just have one quick question. I'm just looking at your testimony, the written testimony you provided, and the map of the counties where you're in. You're in 6 counties. Is the reason you're not in the other counties purely because of funding, or okay, so it's not because the designated agencies or other places don't want you there, it's just a funding issue? Yeah, okay, thank you.
They all want them there.
Yeah, we serve a specific demographic, individuals who in fact are struggling or have not been able to connect consistently with the designated agencies, aren't working successfully within existing services and programs. We oftentimes refer to ourselves as a caboose, right? Folks have gone down the train and, as Hillary read the, little blip about the gentleman who's been homeless for 20 something years. We serve folks who are struggling with substances and with mental health. Folks who are not showing up for appointments, are not making it to their primary care physicians, are struggling perhaps to practice some of the safety measures as relates to the pandemic. Folks who definitely need an intensive level of support in a different way.
Got it. I see that one of the counties you're not in is Rutland County, and you have 2 Rutland County senators here. So
yeah, and actually Rutland is statistically has one of our highest numbers of individuals experiencing homelessness. So it's I think a shame.
Yes, and we do know that Senator Hooker has been very much engaged in the issue around housing and homelessness. So.
Very much so.
All right.
I appreciate that.
Okay. Thank you, and thank you both. We really appreciate your time.
Thank you very much for the invitation.
Good. John Sales is here. Last but not least, John, thank you for being patient.
Always a pleasure to be here. And, there are benefits to being in Zoom land where you can get a couple of things done while you're waiting.
Right.
Although I always enjoyed my hours and hours and hours in committee rooms. So
I know, it's just what we miss it. We all miss it. We really do miss it.
I know. Yeah. I do too, really.
Yeah.
But for the record, I'm John Sales. I'm CEO at the Vermont Food Bank. I know that the food bank is in H315. There is a dedication of about $1.4 million. And that money is actually to reimburse the food bank for the Vermont Farmers to Families boxes that were distributed in January and February. And that was a partnership with the Abbey Group, who was the vendor that purchased the food and built the boxes and did the delivery. The food bank coordinated all those deliveries with the state as a partner. The food security group at the Agency of Human Services and the State Emergency Operations Center has been a full partner in this program. There is a lot of confusion around, there's the federal farmers to families, there's the state farmers to families, and there's a lot of other things going on. So this is specifically reimbursement for boxes that were built and delivered by the Abbey Group to all 14 counties, 19 locations, 500 boxes a day, each at a different location for 8 weeks. The food bank does have, in the hopefully today, right? We'll get that bill passed through the House and to the president's desk. And the food bank will have some ideas, and we've shared some with some folks in the House about some additional support that will be valuable throughout the rest of this year and into the next year. We can talk about that later. And in addition, Senator Lyons, you had mentioned the diaper bank and the money. I think it was 80-some thousand. We have, I talk to Amanda frequently, and the food bank is more than happy to have those funds flow through the food bank and be sub granted out to the diaper bank. We have a great relationship, and that works very smoothly. I'd be happy to answer any questions.
Yeah, okay, that's good. I'm not going to ask about the farmers to families reimbursement piece, because I think I have heard about that myself. My committee members may have a question, but the question I do have a question about the diapers, and that is the funding included in this bill for the diapers? I haven't heard that it is.
The 1.4 million does not include the diaper funding. The
So
diaper
we would
funding
have to,
just was popped in there, I think yesterday, frankly.
yeah, I just saw it today. So,
but it could be, kind of rounding error on that too.
Yeah.
So.
Okay. But you've had success in distributing the diapers.
Actually, we partner some in the distribution. The diaper bank does a lot of their own distribution. We're actually having conversations with them as their volume has grown dramatically, and now they're serving most of the state. So we're having conversations about how the food bank can be a better distribution partner and help them move those products around. It's not something that we've distributed diapers when we get them donated. It's not, we haven't had a regular diaper purchase program, and it would be a great partnership.
All right, thank you. Do you see that as an immediate fast track need?
Yes, for the diaper bank. This will allow them to keep the volume moving at the rate that they have been during the pandemic.
Okay, thank you.
I'll also just add quickly that this is reimbursement for January and February. The food bank and the Abbey Group are also doing this program in March, and there is a possibility now, because the rules have changed, that we may be able to get FEMA funding for those March boxes. So to the extent that that's possible, we're working on that right now. And again, the state's been a tremendous partner in that process. To the extent that doesn't happen, and there is more federal money that comes flowing through, we may be back and asking for reimbursement there also. But that will be in the future.
Okay, I got it. All right, so the 1.4 is covering the first 2 months of the year, and
that's right.
So we'll be seeing some other possible requests if the FEMA falls through.
That's right.
All right. Okay. Committee questions for John Sales. I personally want to say thank you to you and your whole crew. It's been an outstanding example of community support during a very difficult time. It's just amazing what you've done. We constantly hear complaints about gaps and awful things that have happened, but I don't know. I don't think anyone has heard significant complaints about food distribution.
Well, they come straight to us, and we try and resolve them quickly.
Yeah.
And thank you.
Thank you, because when you do that, we don't get the brunt. So appreciate it.
And then just finally, 2 seconds. Everything that you've talked about this morning is essential to solving hunger in Vermont. Mental health issues, the reach up support, housing, all those things are things that prevent hunger in the future. So I support everything that's been talked about this morning.
Thank you. Good. That's helpful. I do have one last question and then we're going to take a break, but that is, have you been engaged in the H100 bill that came out of agriculture for expansion of food access for school children?
Yes, very much so. We're part of a consortium of the nonprofit groups that are working on that, and we're in the room and having input on all those discussions.
Okay, right. Okay, committee, any last questions? Thank you very much, John, and thank everyone who has stayed on with us. We are going to take a break for 10 minutes, and then we'll be back to have a short discussion on H315, knowing that we will come back for a further discussion, probably a bit tomorrow and definitely Friday. And so we'll look at S24 in addition when we come back. So just take a break, take 10 minutes, 10 or 12 minutes, that'd be fine. And Nellie, you can put the screen up and put us on break.